Welcome everybody. I'm Malcolm Alexander, the chair of Health at Hackney.
Where's the leak?
Everybody
Okay,
mute, please.
I'll mute everybody.
Okay.
I'll make sure everybody's muted.
Right. Okay. So we've got 4 speakers today. We've got Catherine Pelley, Chief Nurse and Director of Governance at the Homerton, Judith Davey, Chief Executive of the Advocacy Project, Dawn Freeman, Senior Complaints Officer at NHS England, London Region, and Jo Johnson, Head of Complaints at NHS. Very important meeting because complaints are quite fundamental to the way in which patients and their families relate to the NHS when things go wrong, and sometimes unfortunately things do go wrong, and their investigation of complaints is therefore a very important thing, and to get good outcomes to that process is very important. One of the things we've done, I think you will probably receive of this, but one of the things we did over the past few years was to work with other local agencies to develop this charter to encourage people to raise issues, and also to make sure there was a proper relationship between the complainant and the organisation against which the complaint has been made. And that has been signed by all the major local agencies, including recently GPs, and we're in the process of getting dentists to sign up as well. So that's a very positive thing. So we've only got an hour, so I'm asking the people who are presenting to keep their presentations to under 10 minutes, please. We're trying to sort of fit in half an hour of presentations and half an hour of people raising issues. So could I please invite Catherine to start?
Good afternoon, everybody. I should just say before I kind of go into my speech, I'm the exec on call today. I'm not expecting to be contacted, but you never quite know in my job. So if I suddenly disappear or my phone goes, it's because something happened. But anyway, so yes, I'm a chief nurse here at the Homerton, and for those of you, just to be clear, we cover services both here on the Homerton Hospital site and in the community, and we provide a wide range of health care provision across City and Hackney. I have a lead executive responsibility around patient experience as well, part of my portfolio, and within that the complaints and PALS function. And I think it's probably fair to say that complaints is one way that we get patient feedback. It is not the only way. It is often the most, I suppose, negative feedback that we get, but actually it is balanced with a significant amount of positive feedback about people's and families' experience of our services. So it's in that context that we work around complaints handling. We, like all NHS organisations, have a set of regulations that determine the management of complaints. And that applies to all different types of NHS organisations, and that's set out in how we the expectations on us, both in terms of review and investigation, but also reporting on them. So, for example, there's an expectation that we provide an annual report, which we do within the context of a wider patient experience report. So the way that people can complain to us is varied. Some in person at the time, and that's dealt with. So, you know, somebody on a ward may complain to a ward manager at that moment in time, and that's dealt with informally. And the regulations and all the guidance would encourage informal local resolutions. So whichever way you look at the complaints, the expectation is that you try and deal with the situation at that time. And that's no different than if we complain in a shop or a restaurant, or when we can get to restaurants, and all of those things. That concept of dealing with it in real time, helping resolve the matter, and lots are done at that point. The next kind of phase is a bit more structured, so people can contact our patient advice and liaison service. They can raise concerns and use that as a route in to kind of ask questions, be signposted, or actually raise something a little bit more structured to us that requires a response. We still operate at that point in trying to resolve it in informally in quite a short period of time, and give people the answer to the questions that they have there and then, and if appropriate and relevant, apologise for their experience. So if at that point, or a person feels completely dissatisfied with the experience that they've had of our services, they can formally complain to us, and at that point we have to respond within the kind of regulatory approach. So a more formal complaint can come to us verbally, by email, by telephone, and we still get letters. Not very many. I think when I first started managing complaints teams far too many years ago to count, you got a stack of post every day. Now we get a stack of emails every day, but we still get the odd letter, which is always quite nice, and we get lots of compliments in written form, which is even nicer. But at that point we start a process of more structured investigation. The expectation is that we acknowledge the complaint within 3 working days, and that is the only regulatory measure that is required of us, and we do that in the main. Sometimes if the complaint comes into the organisation into a strange route, that can be delayed, but in the main we manage that acknowledgement. And at that acknowledgement we accept that we will investigate the complaint if it meets the regulations. If it's more than 12 months since the incident, we actually don't have to investigate, and what we say is that we will look at it, and if we can review and investigate that complaint, we will, but sometimes we can't. So if it's 4 or 5 years back, we might not have the staff, we might not have the experience or our ability to give a full investigation, but we will still look at it. But the further back in time, the harder that is. The other time we won't investigate is if somebody's indicated or we've had communication that it's a legal issue. So if somebody's already participating in a legal process with us, we don't go down the complaint route, because we're already using the legal route to do that. So significant claims and things like that. There's still a process that's addressed and responded to, but we don't mix the 2 scenarios. But in the main, somebody who complains, as long as it's in time, we will investigate. We acknowledge the complaint, we share with them information about how they can gain extra support. So they're provided with the our complaints information leaflet. They're provided details of how they can contact Advocacy for support, because sometimes people need more help to articulate the details of their complaint, but also the support to understand the processes, and that gives them a way of doing that. And I'm sure Judith will explain a bit more about the Advocacy project and their involvement in complaints handling. But it's important that people who are complaining are supported to do so, and we can do that, but actually sometimes they benefit from support from somebody a bit more independent. We also provide them information about the charter that Malcolm referenced at the beginning, so they have a lot of information to help them, and we can provide some of that in alternative languages. It's not all in alternative languages, but we are able to provide some of that to them, and certainly our Complaints and Pals leaflet is available in other languages that meet the needs of the residents of City and Hackney. And at that point, the complaint is allocated out to the appropriate division or divisions, depending on what the service is. And sometimes we'll encourage them to pick up the phone and speak to the complainant and try and resolve it. It's not unusual to be asked for an appointment to be brought forward, or somebody to ring them to tell them what they're going to do about something that or it's clear that they didn't necessarily understand what was happening after an appointment. And actually it's much easier if somebody picks up the phone, tries to deal with it. So we would still try for an informal resolution at that point. If that's not possible, we will go through a more structured investigation process. If an informal response is possible, we will still write back to them a letter explaining that they've had this conversation, the outcome, and what we're going to do. So we still respond formally, but we've done that on the back of a discussion with the complainant. Now, obviously, we have to make sure that we've got consent. Often if families complain on behalf of them, so we have to go through the consent process. Sometimes that's quite challenging, particularly if the next of kin that we've got documented isn't the person that's complaining, but we have a process for all of that. But we cannot proceed unless we've got a position of consent, and particularly if other parties like MPs complain, we must get consent, because we can't breach that person's right to privacy. It isn't unusual actually to get a difference of opinion between the family and the patient themselves. And if the patient is still a patient in our care on the wards, we'll often make sure that one of the senior nurses goes and talks to them to make sure that they understand that somebody's complaining, and again try to make some local resolution. If that's not possible, there is...
Catherine, please.
Yeah,
we have to move on. Sorry.
Okay, so there's then an investigation that includes speaking to the patient, family, staff involved, looking at the medical records, understanding the whole context for that complaint. It might refer to policy, it might involve contacting other organisations. We then get a response back from the division and the investigator that goes through a quality assurance process. I read every complaint as they come into the organisation, and I read every complaint before it leaves this organisation. They're then signed by Tracy Fletcher, our chief exec. If they're not signed by her, it's because she's on leave, and one of the other exec directors, not the exec lead for that complaint, will sign it off on her behalf. She delegates that authority. And at that point, we give them a response to their complaint, and we explain to them their rights and responsibilities after that. They have the right to come back to us and ask more questions. They have the right to go to the parliamentary ombudsman. If they come back, we will often offer a chance of a meeting, and certainly the ombudsman would expect us to have met them face to face. And then hopefully at that point we have got to a resolution that is satisfactory. And if not, we would always encourage people to go to the Ombudsman. The Ombudsman is really good at helping people understand what we can respond to, what we can't respond to, and how much we can mitigate for their experience. But I think fundamentally, we will say that we are sorry for their experience, because even if it's not necessarily the perspective of the clinician, they have left this organisation with an experience that isn't good enough for them, that they have not experienced the care that we would want to. And often it can highlight to us other issues. It may also relate to an incident, a claim, something we already know about. And certainly if it links to a serious incident investigation, we tie them into that process and put a clock stop on it. But fundamentally, we want to improve our care that we offer to patients, and we can use complaints to do that. We can't always change what's happened, but we can always learn from it. And that's probably all I really wanted to say at this point, Malcolm.
Thank you so much, Catherine. I'm so used to being at meetings that you chair, so it's nice to have things the other way around. Okay, thank you so much. Judith Davey, please. Judith. Judith is...
Oh, you are on mute, Judith.
You are, Judith. You're in front of me. Hello, Judith.
Yes, she's on mute.
You're on mute.
Oh, I'm sorry. I'm so sorry. What a rookie mistake. So I'm Judith Davey, Chief Executive of the Advocacy Project, and also a member of the City and Hackney Safeguarding Adults Board. You're just about to share my slides in a moment. But just to say that the Advocacy Project is all about voice, rights and choice, helping people understand what their rights are, support them to speak up and make meaningful choices about what happens in their lives, and complaints are a really important part of that. Are you able to share? Yeah, thank you. So what I want to explore today is, are complaints a good thing? And I would argue yes. So moving on to the next slide, because I know we're pushed for time. This is just a picture of somebody that we supported, not in Hackney, in Kensington and Chelsea actually, but had complaints about, so somebody with learning disabilities, physical disabilities and speech impediment. He had complaints about government policy, so we actually supported him to bring his complaint to the MP and others in the Houses of Parliament. So moving on, next, yes, thank you. So long time ago, I read a book, Complaints Are a Gift, and it was it's a book that's had a big impact on my life. You know, I've worked in the charity sector, I've worked in local government, and I've worked in the commercial sector, and complaints being a gift is a common theme throughout all those different environments, because it gives us a really valuable opportunity to learn and improve. We don't necessarily know what it feels like to be on the end of our services or the end of our processes unless people share that with us. Complaints give us a really important opportunity to improve. So we would argue that complaints are a really good thing, and lots of complaints doesn't necessarily mean that an organisation is not good. Lots of complaints might mean that an organisation is very open to feedback, makes it very easy for members of the public to give that feedback. So maybe, you know, large numbers of complaints are good. Conversely, an organisation with a small number of complaints, that's not necessarily a good thing, because if it's really difficult to complain about something, and we can all think about whether it's utility companies or phone companies where it's really difficult to complain, so we think, oh, can we be bothered? So there's some really interesting things here. It's not always as you might initially think, but you know, our strong view is that complaints are, you know, a really good thing, a gift, because it helps us. It helps all of us in health and social care, in local government, in the charity sector, really improve things. There are a number of barriers to making complaints, and Catherine's touched on some, like language and accessibility, so I won't repeat those. But there are some barriers to making complaints in terms of culture, if I can put it that way. You know, we all know that the NHS is absolutely fantastic and does an amazing job in all elements of the NHS. So when something goes wrong, we do understand that people are doing their best. So sometimes we don't want to complain because we do understand that people are trying to do their best. But without that feedback, we won't be able to learn and improve. And that's a really, really key thing. So looking at NHS complaints, next slide, please. So the Advocacy project, we are responsible for delivery of advocacy in Hackney, statutory and non-statutory. And as of 1st of April, we have also taken on responsibility for the NHS complaints contract. So, you know, this is our first engagement on that. And we work closely with Healthwatch, and John from Healthwatch Hackney says, and it's really interesting, sometimes making a complaint is a real challenge. Where do I start? Who can help? The Advocacy project is here to support you so that your voice is heard and actions taken. So Catherine described very well the process to go through. I think the thing about NHS complaints advocacy is that if you need it, we're there to support you every step of the way, whether it's preparing letters, preparing for meetings, whatever it is, we are there to help and support you. Next slide, please. So NHS complaints advocacy, it's free, it's also independent, and again picking up on something that Catherine really helpfully said earlier, it is independent. There are other services, of course there's the NHS complaints functions, there's things like the PALS service, and they can also help with complaints, but they're part of the NHS. Sometimes having that independent view. We're not part of the NHS, we're part of the health and social care kind of ecosystem, if I can put it that way. And you know, we're critical friends, and you know, the NHS is a critical friend of ours, but we are independent. So sometimes we can help you bring those things in a sharper but constructive way. And also important to say that you're in control at every part of the process. There is nothing that we would do without getting explicit instruction from you about that complaint and how you want to move that forward. And I think those are really important things. Next slide, please.
Just a couple more minutes. I'm sorry.
That's fine. I'm nearly done.
Okay.
So some examples: you can complain about, you know, every aspect of the NHS. I'm not going to read out the list. You can see it here. And the kind of things that you can complain about are treatment, care, attitude, whatever it is. If you feel that you want to make a complaint because you want it to be better for the future, for you, for your family, but for everyone else, you know, that's the kind of thing you can complain about. There is a video link here. I'm not going to play it now, but we can send the slides out afterwards so you can see this. And there's some real life examples of how NHS complaints have really made a difference. Nadia being one, she felt, and her name has changed to, you know, has been anonymized, but Nadia felt her GP didn't really understand, wasn't really listening, wasn't really, you know, hearing what she was saying. So she spent quite a long time trying with that GP. In the end, she changed GP and then made a complaint. And it turned out that she had endometriosis. And she then, working with the NHS complaints and the GP, then took it to the Ombudsman and got an apology, and you know, action was taken in a particular situation. So through this, she felt some satisfaction because she got an apology, but also the system was made better for everyone else. And really keen and happy to endorse the thing that Malcolm touched on earlier, the Health and Social Care Complaints Charter. Next slide. Not going to go into this because Catherine's already touched on it. And then the final slide is just how you get in touch with us. So please reach out. But thank you for the opportunity to share and also to learn from others.
Thank you very much. Would Dawn like to join us now?
Yeah, so if you could invite me and Joe in, because we're just going to do the presentation between us, and then that will just cut down a little bit of time.
Okay, thank you so much.
I think Joe's Joe's going to start off.
I'll start off. Yeah, first of all, thanks for inviting us today. What I'll do, given that some of the things that Catherine and Judith have already covered, I will try and stay focused on the role of NHS England in the complaints handling system. To just say a little bit, so Dawn and I are from the London NHS England team, and we manage complaints about primary care services in London. So our team we've got 16 people in our team, and we manage about 2,500 complaints a year, and these are formal complaints. These are predominantly about GP services, although we do manage complaints about dentists, pharmacists and opticians, and we also deal with complaints about specialised commissioning service which NHS England commission, and we also manage complaints about care in prisons and immigration resettlement centres as well. But our predominant work is about complaints about GPs. Just to mention something about, Catherine did mention the sort of legislation. So NHS England works under the same legislation as Homerton and other acute hospitals. And in a moment, Dawn will talk through what the NHS England complaints handling process looks like. But I should explain that under the regulations, if somebody wants to complain about a GP, they can complain directly to the GP, or if they choose to, they can complain directly to NHS England. So you can't complain about, you can't go to the GP and then to NHS England. If you're unhappy with the GP response, the next stage would be to go to the Health Service Ombudsman, but you can complain directly to NHS England if you prefer that. And sometimes people do prefer that if they feel that they, by going to NHS England, you get somebody from outside the practice to look at it. So that's why we get, obviously we get, 2,500, we get quite a few complaints from patients. I should also mention that Catherine talked about the PAL service, which Homerton have, and you would have heard of PALs probably in other acute hospitals. NHS England doesn't have a PAL service as such, but what we do have, we have something called our customer contact centre, and they are based in Redditch. And essentially, before a complaint comes to the regional office, our colleagues in Redditch will try and work with the patient and see if we can resolve it informally. So if there is a possibility to perhaps, speak to the practice, if it's, say, for example, about getting an appointment or something which we can hopefully resolve quickly, then we will try and work with the practice and try and get early resolution. So the cases that come to us are much more kind of formal. So when Catherine described earlier the kind of more formal structure where we go into investigation and go out for responses, those are the cases which are managed locally in the regional setting. Can I have the next slide, please? And so just to get, this is just a kind of a sort of an overarching statement which describes our kind of mission statement really around what we expect and what we expect to deliver to our complainants. So obviously one of the things, the key things, that we're unbiased. We try to be non-judgmental in the way we manage complaints. We also emphasise trying to be transparent. So in a moment, Dawn will talk about our process and what we do. If we go and get something called clinical advice on a complaint, say for an independent doctor to look at a complaint, we will share that advice with the complainant. Obviously, we try and be timely and reply in an appropriate manner. And what we'll do at the beginning, we'll have a discussion with the complainant about that time frame, how quickly we'll respond. Yeah, and then the outcome. So a written response will set out any actions, any learning, and explain to the complainant their rights, to progress if they remain dissatisfied and they want to progress with the Health Service Ombudsman. I'll just hand over now to Dawn to talk through our timeline.
Thank you, Joe.
So obviously we've shared that there's a slide there that we've shared on the process. It kind of just allows people to have a bit of an idea of how their complaint will be handled when it reaches NHS England. Basically, it's received into the London region, allocated similar to how Catherine spoke about, allocated to a case officer, and then that person will acknowledge the complaint and then and request consent. Likewise, under the complaint regulations, whenever we have to, before we can send a complaint to the provider, we would always get consent from the person, because we're going to be sharing their data, and their data is going to be shared with us, and under the GDPR that would be required. We would normally ask for that in writing, just because it makes sure as well then that the person, we can be sure that the person that's has given proper implicit consent around where their data is going to be shared with. So within 3 working days, as explained, they'll receive an acknowledgement to complaint. We'll give 10 days for their consent to be received, and then the consent will come back and we'll forward it to the practice. With our providers, what we do is we allow 10 working days generally for them to send a response back to us. Sometimes, if the case is quite complicated, we might allow a a buffer of a time, and if that was the case, then we would keep the patient updated if we thought we wasn't able to respond within the timescale. And also an advocate as well, because when we send out our acknowledgement letters and in the information to the patient, if they're being supported by an advocate service, they would be copied in at that stage. Once the response is received, it will be reviewed by the case officer and make sure it's answered all of the points that's in the complaint. And then if it needs a review, so say for example, if it was about clinical care and treatment, we forward that to a team of independent clinical advisors who will review the complaint, the response and medical records, and they will then come back with a decision around the care and treatment, and let us know whether that was in line with local guidance. With an acute hospital, they have a medical director that's responsible, and NHS England has a similar process. We just have to kind of do that slightly different. We might also share that with our contracting team. So if a complaint's regarding something to do with a contract, i.e. a patient removal or maybe registrations, then we would share that. We've got different teams within the organisation that we can share for with response. We then draft a cover letter, and then it goes through to our director for sign off, and then out to the patient, where we would advise that obviously the first stage of the complaints procedure is generally complete unless they've got further comms. So we can just move to the next slide. So again, it's just really just summarising that. So we acknowledge the complaint and obtain consent, contact the practice and discuss the complaint, request a response and the records, review the response, send for clinical review or contracting review, and then draft a cover letter and send that to director for sign off. And then Joe's just going to finish off the last 2 slides.
Thank you very much, Dawn.
Thank you, Dawn. Yeah. So just to kind of sort of wrap up, really, one of the key things that we, NHS England, not just NHS England, but all NHS organisations, it's about, learning, how can we learn from complaints? And NHS England, we have this database called CRM, where we, at the end of each complaint, we will summarise any learning, and then that goes into what we call sort of a national kind of deep dive. And so London is one of 7 regions in England which reports into this database, and then we can take learning from that. And one of the key things we've been looking at recently are complaints arising from the pandemic, because obviously COVID's had a huge impact on the NHS, and one of the things we've been looking at is how it had an impact on things like GP services and how patients can access GP services while this pandemic is going. So just to emphasise that. And then finally, just to wrap up at the end, we've just included our direct contact numbers and emails, and just to emphasise that we work pan-London, so our team works right across London, so we deal with complaints right across. So we've got email boxes which kind of cover the various patches in London. Thank you.
That's very kind. Thank you so much. Thank you, Joe, and thank you all the speakers. Now, questions, please. Who would like to ask a question? Catherine Perrin. Sorry, Catherine Phillips.
Yes, this is a question for the Advocacy project. What if any, of the restrictions on who you can support in terms of making complaints?
NHS Complaints, it's open, anyone can complain. If it's complaints under other aspects of advocacy, like if we're supporting somebody under the Care Act or the Mental Health Act to make a complaint, there is an eligibility process there. But NHS Complaints, anyone can complain.
And you'll provide, what sort of support will you provide?
So on the website, or we can send you. We can send either by post or in easy read, whatever format people require. We've got a self-help pack so that people can know the process and know how to complain themselves. If they want advocacy, we've got documents there on the website and elsewhere, posters, leaflets about how to access that. And if people do want NHS advocacy to make a complaint, we will be there the whole of the process, if that's what you want us to do. If you want us for parts of the process, that's fine. If you want us for the whole process, that's also fine. So that might be helping you formulate what the issue is, and then writing the letter and where to send it, preparing for meetings, all those kind of things. So if anyone wants to know the details, please just follow up with me afterwards, or look at the links that I put in the presentation.
Okay, thank you very much. Nadia.
Yes, hello everyone. Well, I may have missed it at some point, but what I find is that when I've made a couple of complaints, I don't, one at my surgery and one at the hospital, at Homerton Hospital, I didn't get any feedback, you know. I got a receptive response to a certain degree, but then it was just left. So I don't know, can we expect a feedback, or, you know, like, what did they do afterwards? So because I tend to ring, I like to ring rather than write, so if I can, and then I've had positive responses in both cases, but then it was left, if you know what I mean. So I don't know if there's an answer to that, or is that part of the process?
I was going to say, I can answer from NHS England. So if it's regarding the primary care provider, so for example, you mentioned the GP. So once you've had a final response, so any outcome from the complaint will be in your cover letter from us. So if there was learning or there was something we was working with the practice, that will be where we'll feed that back to you. So if you chose to come through NHS England rather than going to the provider, that will be at the point of where we're going to let you know what's going to happen. Yeah, so there is no more feedback after that final response letter.
Yeah. So, I mean, I've never made a complaint to NHS England, but I made to my surgery and the hospital, and in both cases they were on the phone. So I would have appreciated somebody who got back to me, you know, and said, this is what we've done. I don't know if that's normal, or
maybe Catherine Pelley might like to respond to this one.
So I can respond on behalf of the hospital. So if you phoned up and said you want to make a complaint, we will take your complaint and agree with you how you want that feedback. So if we can, you know, we ring people back with the outcome of their complaint, we email, we write. I think if you've rung in and it was dealt with and your issues resolved, it may well have been that somehow we've believed that the issue was resolved, so we've not necessarily felt that there was a need for a structured letter to you. So it depends on which part of, you know, if you come in, particularly if you come in via the PALS route and the more informal route, and the issue is resolved, you won't necessarily get a letter. Maybe offline and through Health Watch, we can pick up, I can look at your specific issue, but that's, you know, so if you're making a formal complaint, there is always an outcome letter, and within that we do say what we've learned, what we've found, what we've learned, and what we've done to improve. But we also pick up a bit more thematically in our annual patient experience report, which goes through our committee structure to board. So it's probably a little bit dry reading, if I'm honest, but you know, that does pick up the wider learning. But maybe outside of here, if there's a specific issue you feel we can still address with you, we can do that. I don't think it's necessarily appropriate to do it with the rest of the participants listening, but certainly happy to have that conversation outside of the meeting.
Okay, thank you very much. Patricia.
Hi, it's Patricia Charlesworth here. Yeah, what I wanted to ask the lady to do with advocacy, do they, can she tell me, do they have self-advocacy as well for people who have a learning disability and need support, but just need support around that? Could she answer that? And also, do they do it in Easy Read? Do they have all their information in Easy Read?
Is that one for me?
Yeah, Judith.
Yeah. Thank you. Yes, we do have our information in Easy Read. We will, you know, we do encourage self-advocacy, empowerment, helping you complain, do whatever for you, you know, supporting you to do that. So yeah, absolutely, both of those things. So again, if you want to give me, contact me, give me a bell, follow up with me on email, really happy to do that. But yes, absolutely both of those things.
Thank you so much. Ida.
Okay, this is for Catherine Pelley, I suppose. If you're not happy with the letter you got, say outcome letter about the complaint, so where do you go from there?
All the letters explain how you can, if you're not happy, that you can come back to us, or you can go to the Parliamentary Ombudsman. I think it's fair to say sometimes we don't actually get our responses right, that the issue that the complainant has may not have been completely addressed, or actually we've maybe misinterpreted or misunderstood their issue. So we don't always get it right. So what we would then usually offer is the opportunity for a meeting, and those meetings include the individual making a complaint, their support if they want to bring support, whether or not that's an advocate or a family member, or well anybody, to be honest, and then we will have people there, and that's minuted, and then we respond. But if at that point you remain dissatisfied, that we would encourage you to go to the Ombudsman, because actually the Ombudsman's really helpful to us as well in understanding whether or not we are getting this process right, and actually addressing the concerns of individuals. And sometimes we don't, and sometimes we just we need somebody to kind of look at it with a fresh pair of eyes, but that would be the main route in. We've also started trying to encourage people to give us feedback on the actual process, but we need to do more work on that. And just in response to Patricia's comment about learning disabilities, we can support people with a learning disability around complaints as well. So we have processes to do that, and do recognise that we need to find ways to make it easier for people with a learning disability to complain, but also respond in a way that they can then participate more effectively in. And certainly if we're not getting that right, we'd certainly welcome understanding a bit more about how we can do that, because it's probably slightly more challenging to us, if I'm honest, but something we do want to get better and better at.
Okay, Ida. Is that okay? Okay. Are there any more questions?
Yes. Oh, sorry.
Who
I think
is?
Jacqueline.
Sorry?
Jacqueline.
Jacqueline. Hello, Jacqueline.
Hi, you are on mute, Jacqueline.
Can you hear me now?
Yes.
Yeah.
Yeah, just two short things. One, by way of observation, I found this session as a patient very helpful. Some of the way the presentations are done are very clearly NHS talking to informed people in NHS. I still think there's a lot of room for sort of trickling the information better to patients. And secondly, I'd just like to talk about a personal experience. I'd like to say thank you, first of all, to the Homerton. You've done a great job. I've spearheaded the Hackney Heroes, giving the gifts to 1,000 staff. I was a patient, and I won't go into all the details, obviously, now, but happy to catch up with Catherine. Back in June 2019, I had a long operation and I got admitted into ICU. And it was almost the reverse of a complaint. There was a big problem with my admittance into ICU due to lack of beds and a misunderstanding, and I had quite an adverse reaction and needed to be admitted. And the next day, the deputy chief nurse came and talked to me to apologise for the whole process. I have worked in health before, and it was obvious that she was talking to me from a concern of whether it was a possible cock-up or whether I would complain. And without going into all the details, I think some of those processes, even though I'm, pretty articulate, it was almost indicated that through going through that process, I wouldn't complain. It's not a personal, I'm not hitting out at anybody, but I think the whole process was very muddled, and I'd be more than happy to take that up with you, because it was quite concerning that as I was actually being wheeled into ICU, this debate was going on with the clinicians as to what should happen. And the next day, as I was on very strong drugs, being asked, you know, we're really, really, really sorry, and almost expected not to complain. And with hindsight, I think that should have been followed up with possibly a complaint or an end to that incident, which didn't really take place. So I don't want to sort of go on for too long, but I hope that's
okay.
helpful.
Let's ask Catherine to respond to you.
So thank you for your work around Hackney Heroes. We've absolutely felt the love of our community in the last 12 months. So thank you, and we continue to feel that. And I think I've made the point a couple of times, we don't always get this right. And from what you're saying, we probably didn't get it right. I think I'm certainly happy to have a conversation offline about this specific incident. And it may well be, if there was a concern, there will have been an incident, it'll have been looked at, and we've probably got documentation. But whether or not we've closed the loop on that, I think maybe we haven't, but from what you've said. So apologies for that. But I think we can definitely learn from that. And I think your point about jargon and language is really important. You know, I'm 36 years in the NHS, and I talk NHS speak, you know, professionally. So I sometimes forget. But one of the benefits, I'm a health visitor, so I'm not an acute nurse. I spend a lot of time deciphering letters that come to me to make them easy. And one of the things I actually do for letters longer than a page, I read them out loud. Because actually, if you read them out loud, that's how somebody hears it when they're reading it on a Saturday morning when it's landed on their front door step. So sometimes those things, and trying to encourage people to do that. And I think sometimes the level of intellect that we're working with within our clinicians is often forgets that actually not everybody's got a medical degree. And I haven't got a medical degree. So, but the more we can do and the more feedback we get on that, the better, because we should be writing in language and words that the complainant will understand and interpret, not our own speak, which is confusing at the best of times.
Thank you
very much. I'll come to you in just a moment, Debbie, but I just want to ask Jo and Dawn about the specialist services which are commissioned by NHS England. It's like total parental feed, those sort of very specialist services, and how people make complaints about those. Is that your department?
That's it. That is correct. Yeah. So it has to be a service that NHS England commissions. So, for example, like Great Ormond Street, quite a lot of the services that come out of there, some of the gender reassignment stuff. The Royal Brompton might be a service that we commission, and what they do is they just come in literally to the same way they would for any complaints. So they come into the contact centre, and then it's given out to the region for whoever manages the particular contract. So on the presentation slides, we gave you details of the local teams, but what we would always ask, even for anybody that might be supporting a patient, is please use our contact centre for logging new cases. Just because it can make sure that it goes out to the correct region before it comes out to the teams. They will get contact from the local team, and they'll get an generic email address that they can use and liaise with their case officer. But we would ask that they just, in the first instance, come in, and then we can just make sure it gets logged. But yeah, any of the commission services that we, so for example, something like the Great Ormond Street stuff. There's a whole list. I think there's 364 items in a booklet of items that we commission and specialised commissioning. So I won't take up time going through them, but hopefully a couple of them kind of help you understand.
And we can always share those separately with people if you want to have a look at that.
Okay, that would be very helpful. Thank you very much. Debbie.
Hi, everyone. Thank you. A question really for all the speakers. When you talk about information that you produce and send to people, somebody mentioned that it's in other languages, and I'm assuming it's in large format as well. But when you produce those, are they 100% the same as the one that's in standard format, or are they abbreviated in any way? So in other languages in large format, would they be abbreviated or just truncated? I'm asking the question because I was speaking to someone with visual impairment recently, and she said, I don't get the same information in my large format information as in the standard information. not quite sure how she knew that. Presumably she had been in discussion with someone, but she said, you know, just because I've got a visual impairment doesn't mean to say I'm, you know, I can't understand things. I was just wondered whether that was whether there was an abbreviation in your alternative formats.
So from the Homerton's perspective, I'm about to say something, but actually I'm also going to go and check. So so I don't read most of those languages, but the expectation is that it's exactly the same. But I would need to absolutely confirm that, because as I said, we've got 7 or 8 languages and I don't read them. But as I said, I expect it should be exactly the same as the standard written English. But I will also make sure that I check that, because I've never even thought about that it would be different. But.
Yeah, Catherine, can I say something? I think what happens, I think it's all the same, but it's probably a lot of the complicated information is put in another way, maybe. So I can't remember what they call it. It's like easy read. You don't use all the words, but you explain in another way what things mean. Otherwise, you'd be taking up 50 sheets of paper.
Mm. Yeah. Thank you, Patricia. You're probably right, particularly for where it's translated. But I think what's really important is that we make sure that we're clear if there is something that's not there, that they can access what's not there. So if it's some of it's a bit more peripheral information that they don't absolutely need to know, we need to make sure people do know. But Debbie, I think it's a really important point, and I definitely will go away and check that, because actually we should be making sure people have the same right of access, and the accessible information standards that we're held to account for set that expectation. And sometimes that doesn't always happen, and I know Joe and Dawn will have the same kind of issue as well, but it's a really, really important point.
Thank you very much. Ida's got a question.
Yeah, I just want to ask Advocacy Project, when they say, you know, we have them in all different languages, how many languages do you have? Because it's really important. We don't say that we have them when we can't actually produce them, because within Hackney, we have over 200 languages spoken. So I'm just thinking, you know, something we need to be absolutely clear when we say we have them in all languages.
Yeah, absolutely. Great point. So there are a lot of community languages in Hackney. So we usually put things in maybe 4 or 5 languages, the most commonly used. But we also have access to you know, translation and interpretation services. And if we're working with somebody, we will, for that person, absolutely translate everything. So there should be you know, nobody that doesn't get in the language they need. Sorry, I was just watching the thing, somebody's come up in the chat. Yes, so we produce in a small number of languages leaflets. Any other requirement, easy read also being part of that. Anything else that's required when we start working with that person, we will, without a shadow of a doubt, go and get it translated into that language. And if we need an interpreter, that's absolutely what we'll do. But great question, Ida, thank you.
Can I just respond for everybody concerned? When we talk about, you know, we have to look at it holistically, and sometimes even people in their own languages cannot read. So we need to be absolutely clear when we talk about, oh yeah, we do this, we do that. So it has to be person-centered. It has to be taken in account of individual, and it has to be holistic. It's not a one fits all. So my plea is make sure that when we send messages, they are very clear and they're explained. And, you know, as far as I'm concerned, I will continue to fight for this within Hackney.
Great. Really, really great point. Thank you for making that. Absolutely.
Thank you very much. I'd like to ask a question, actually. I mean, one of the things that I've noticed is that serious incidents are really examined very, very closely, and there's a very clear process for outcomes of the investigation of serious incidents. I just wonder whether it's the same with complaints, whether that sort of process of, you know, I've been, I meet Catherine regularly at the Serious Incidents Committee, and I see the whole very sophisticated process of making sure that investigations lead to service developments. But I'm not clear whether this is true for complaints. I just wonder if everybody would like to comment on this.
No, I think you raise a really important point, Malcolm, here. So from the Homerton's perspective, so you're right, we've done a lot of work around making sure our serious incident process is much more open and transparent and robust. And actually this time last year I was writing, well, slightly longer than that, the plan to do exactly the same around complaints, and a kind of pandemic got in the way. But we've started working with the Patients Association to do exactly that. So actually I have, it won't be with every single complaint, but we are looking at having some form of assurance panel process, and we're looking at how we can use patients and the public to help us with that, to start looking at are these investigations, particularly high risk complaints, thorough, open, transparent, but also how are we learning. But we also feed that back in. We've got a patient experience committee that looks more thematically, and some of that then gets reflected back through our quality account. So we've got a quality account priority around first impressions, and that is basically because we got an awful lot of complaints and PALS queries about reception staff and how they were greeted on entrance into our services. So we decided to do a bit more systematic work on that. But I think it's still work, certainly from my perspective, and one of my ambitions for this year, pandemic permitting, to kind of improve.
Okay, thank you very much. Anybody else like to comment on this?
Yeah, I was going to say, from a point of NHS England, I mean, obviously our process, we've explained our process works slightly different, but if we was to identify out of a complaint that there was a serious concern regarding a GP or a dentist, then we've got a process that we can where we would refer into a triage service, and that gets taken separately for the GP and the medical director at our performance team to work individually with that doctor, because obviously doctors are independent contractors, and although NHS England has the responsibility on their medical director for the performers on their register, obviously they are independent businesses, which is slightly different to like a hospital trust. But as for complaints, we're always looking for ways to learn. So we always identify. So like Catherine was explaining, we seem to get quite a lot of complaints. And if you look at the data around patient removals, and so that's one of the things as a team that we kind of really looked at, and what could we do to try and improve that for the patient experience, not for, you know, the providers, but so the patient experience was going right. So we went out and we done some training to our particularly actually in North East London, we've done a lot of training with our practice managers in their forums around the right process to follow. And actually for a while we've seen like probably a dip in those numbers of those cases. So, you know, I think we're always looking for to take complaints seriously. Definitely within the team, we'll notice a particular, and if we notice a particular trend around a practice, you know, maybe if one's coming in, then we'll definitely highlight that through for our contracting and performance teams to definitely take up separately, you know, for their channels that they've got that they act under the regulations for.
Thank you very much. I wonder whether Judith would like to comment in terms of the NHS contract that you're about to start. How you might look at outcomes recommendations from complaints investigations, and what role do you think the advocacy project should have in that?
Yeah, really interesting point. So internally, any complaints that we get about the advocacy project, I
don't mean about the project. I mean issues that come up.
All right. Okay, that's fine. So we have a governance board in Hackney, and John Williams, you know, the CEO of Healthwatch Hackney, sits on that governance board along with senior commissioners from the local authority and also local health services. So trends and issues are brought to that meeting and discussed. And if there are particular complaints or particular issues, it's reported to that forum so that we can all, between us, make sure that the learning is there and addressed. So that's what I would say right now. But also important, I think, is the role of the advocacy project, or whoever has that the contract for NHS complaints, in terms of making sure that systemic learning is shared with other agencies in the borough. We certainly see ourselves as contributing to that.
Thank you very much. Any final questions anybody would like to ask? Well,
can I ask one question, Malcolm?
Yeah, go on.
I just want to know, all the findings you all get for advocacy project, where does that go and sit with? Because my clear concern is conflict of interest. When everybody sits together, sometimes it becomes quite muddy, the processes and the chain of command. So I just wonder, so how do we safeguard against that?
Maintain our independence.
Yes, maintain your independence,
absolutely.
And for the benefit of Hackney residents.
Absolutely. And there's quite a lot to say around independence. Malcolm, I don't know if you want me to respond to this, because it's probably quite a long answer and it's quite an important answer. So I don't know if we want to do
a short form, because we're just at the end of the meeting.
Yeah,
but so, you can give a short form now, and then perhaps you can give a more detailed response after the meeting.
Yeah, absolutely. So in terms of the advocacy project, we are structurally independent from any health and social care or anyone else. We have strict conflict of interest policies, conflict of duty, loyalty, all those kind of things. We have independent governance reviews that other organisations do to make sure that we are independent. The fact that we sit together with other agencies in a governance board doesn't mean to say that there isn't independence there. We bring our issues to the table. John from Healthwatch brings issues to the table. Commissioners and other so London Borough Hackney, I shouldn't say commissioners, London Borough Hackney bring their issues to the table, as do Elft and others, and it's worked through at that meeting. There are clear, transparent actions and all the rest of it. So it really is there, but there's a lot to say on that, and happy to follow up with whether Ida or you, Malcolm, or anyone else separately.
Okay, well, that's it for today. Thank you so much for that. And can I thank Catherine, Judith, Dawn and Joe for your contributions today, and everybody who's been present and who's asked questions. Very grateful to everybody.
Great session. Thank you.
Before
very enjoyable, very interesting. Thank you. And also there will be a recording, so everybody will be able to hear exactly what's gone on.
Great.
Yes, and before everyone goes, I just wanted to say thank you very much as well, and to let you know that we will have our April information exchange on 27th of April, and we will be talking about hearing loss, symptoms, types of hearing loss treatment, tests for hearing loss, the hearing aids, and preventing hearing loss as well. So that you can find out more if you follow the link, and book if you want. Yes, thank you very much for joining. Enjoy the rest of the nice weather. The rest of the day. Sorry.
Thank you so much, everybody.
And I hopefully see you.
Thank you, everyone. Thank you. Have a good day, everyone. Bye.
Thanks. Bye.